Hey guys, in this lesson we are going to be talking about appendicitis as it occurs in our pediatric patients. Now I know you've already come across this topic in your adult courses, so what I want to do is just really focus on the things that can be a little bit different for kids. Appendicitis is actually the most common cause of emergency abdominal surgery in childhood, so you are really likely to see it during your clinicals. Now let's just do a quick refresher. The appendix is this little pouch that extends off the cecum, and it's located in the right lower quadrant of the abdomen. Now what happens in appendicitis is that this little appendix becomes inflamed and infected. And if that's not surgically removed, that appendix can then rupture or perforate, which allows stool to leak into the abdomen. And so you've got infection and inflammation spreading throughout the abdomen, which can lead to shock. Now, this complication can happen in adults as well as children, but there's an increased risk for perforation in kids. And the reason for this is because diagnosis of appendicitis can be a little bit trickier in children and is often delayed. Now, generally, appendicitis is diagnosed with a thorough physical exam, a CBC looking for signs of infection, and a CT scan of the abdomen. And this is the same for kids, but with kids, you have a really difficult time getting an accurate clinical picture because they have a difficult time explaining their pain to others. So let's just talk a little bit more about how the abdominal pain associated with appendicitis is a little bit different for kids. So the first thing to know is that this pain for children is going to maybe be a little bit more non-specific than an adult would say. And they usually describe it as being in the center of the abdomen or sort of around their belly button. And this is really different than that right lower abdominal quadrant pain that we associate with appendicitis. Now, over time with kids, it will migrate or move down towards that right lower quadrant. But for the first day or so, they're not really going to give you that clear clinical picture. In adults, it's really common to check for rebound tenderness, but this is really difficult to test in kids who are very anxious and in a lot of pain because you can't get them to lie down and relax for the procedure. So it's really important, or a helpful thing we can do in place of rebound tenderness is pay really close attention to the child's posture and look at how they're positioning their body. Most kids who have severe pain are going to lie really stiff and motionless on their bed because they are very afraid to move. And you may also notice that they're very reluctant to move that right leg, or they have a decreased range of motion in that right hip. One thing to always make note of in regards to pain is that if it suddenly goes away, this can be a sign that the appendix has actually burst, which is not good, and it makes treatment a lot more complicated. Other symptoms that are associated with appendicitis are nausea and vomiting, decreased appetite, and also fever. Treatment for appendicitis is to have that inflamed appendix surgically removed. So our nursing care can be divided up into thinking about it in terms of pre-op and then post-op care. So prior to surgery, our nursing care is going to be all about managing that child's pain and making sure that they are prepared for surgery. So we want to make sure that they're NPO, and they're probably going to need to be started on IV fluids. Now, one thing to note about our pain management is you want to make sure that you don't use heat packs on the abdomen because this could actually cause the appendix to burst. Your nursing priorities after surgery are going to be all about monitoring for complications like an ileus and infection. Now remember, an ileus just means that the bowels have not started moving again and they're not working properly. So your nursing interventions for this are going to be focused on monitoring for that bowel function and most likely keeping that patient NPO until the bowel sounds return. Because they're NPO, they're going to need those IV fluids, and you're probably going to keep them on strict I's and O's so you can keep a close eye on that as well. Now remember, for patients with a perforated appendix, management is going to be a little bit more complicated and recovery takes a bit longer. So that perforation means that infection has spread all throughout the abdomen. So the bowels are going to be a little bit more sluggish, and they're also going to need IV antibiotics. There's also the possibility that they're going to have an open wound or even a drain in place. So we got to make sure that we give them appropriate wound care as well. Your priority nursing concepts for a pediatric patient with appendicitis are gastrointestinal and liver metabolism, elimination, and comfort. Okay, so let's walk through the key points for this lesson. So appendicitis is an inflamed appendix, and it is the most common cause of emergency abdominal surgery in children. Now, sometimes appendicitis in kids can be a little bit more difficult to diagnose. Remember that delayed diagnosis causes an increased risk for perforation. Treatment for appendicitis is an appendectomy, which is just the surgical removal of that inflamed appendix. And our nursing care is going to be surrounding that surgery and making sure that we reduce complications like peritonitis, sepsis, and an ileus. This means we have to be on the lookout for those signs of infection, making sure we're giving those antibiotics if they're prescribed, and then also monitoring really closely for their bowel function to return to normal. That's it for our lesson on appendicitis in pediatric patients. Make sure you check out all the awesome resources that we have attached to this lesson. Remember, a lot of what we talked about today is just going to be added on to what you already know about appendicitis from what you've learned in your adult courses. So refer back to that if you feel like you need to fill in the gaps a little bit. Now, go out and be your best self today, and happy nursing.